Namaste. Today we are going to discuss about crash cart. Okay, so this is a crash cart. This crash cart will be used whenever the cardiorespiratory arrest. When patient had a cardiorespiratory arrest, doctor will ask for a crash cart. So always make sure arrangement of a crash cart. It should be fulfilled. Okay, so whatever the checklist is being given, as per this you have to arrange and keep all the time. So whenever the crash card are used to the patient, immediately the staff responsibility is to refilling of items. Okay, once refilled, it has to be sealed for a next use. Okay, and now I am going to explain you in detail what are all the items we have arranged in a crash card. This crash card consists of top crash card and middle crash card, and here you can see 3 drawers. Okay, and bottom crash card. Okay, now I'll explain one by one what are all the items we have kept in a top crash card. So here you can see the things. You see already it is labeled. So as per this we have arranged and kept. We have in our top crash card ET plaster, ambu bag, both adult and pediatric, and along with the reservoir bag you can see, along with the ambu bag, reservoir bag and mask. So adult and pediatric mask also we have, and spray. Okay, this is our lock spray we have here, and ECG electrodes again for a monitoring of a patient ECG electrodes here we have, and bougie stillet. Okay, here you can see pediatric and adult bougie we have in a crash card. So this is a adult bougie and stillet, adult stillet, and this is a pediatric bougie. Okay, in a top crash card we have a ambu bag, bougies, stillet, lock spray, ECG electrodes, ET plaster, ET ties and ET fixing plaster we have, and jelly, conduction jelly. For whenever we use a defibrillator, definitely we require jelly, and this is a pediatric ambu bag. Okay, in a pediatric ambu bag you can see ambu bag consists of mask, different size of mask, reservoir bag, and oxygen tubing, O2 tubing, and here you can see stillet, pediatric stillet, and laryngoscope. Make sure whenever you check the crash card, it should be in a working condition. Okay, so laryngoscope is in working condition. So these are all the items we have kept in a top crash card. Ambu bag in a different sizes, adult and pediatric, ECG electrodes, jelly, ET plaster, lock spray, and bougie stillet. These many things are there in top crash card. When you come to the middle crash card, you can see the defibrillator. Okay, so make sure all the time the defibrillator should be worked every day. The ICU nurse responsibility is to check for working condition. Here once you start a testing program, no, here you can get a ECG strip also. So with that we can identify whether the defibrillator is working or not. So we have a defibrillator in a middle crash card, and these are all the personal protective equipment, sterile gloves and examination gloves, apron. While procedure doctor will use a apron, under pad for a bed protection, and mask. Okay, and whenever we load a medications during emergency, we can write a label and stick it onto the injection. Okay, so this is regarding middle crash card. Okay, next, these are all the medications and airway content we have stored in these drawers. There are 3 drawers. Okay, one is medication and airway contents. This is a circulation. So whatever the circulation related items, I'll show you one by one. So in the medications there are 2 categories. One is priority drug and another one is secondary drug. In a priority drug we have kept atropine, adrenaline, adenosine, cortisol, soda bicarb, calcium gluconate, and xylocarb. So, in a secondary drug, you can see noradrenaline, dopamine, hydrocort, dobutamine, epsolin, medas, naloxone, digoxin, and lasix. See, you can see these are all medicines comes under high risk medication. Okay, so since it is in a high risk medication category, so this has to be kept under log. Okay, again in our next video I'm going to explain in detail of high risk medication policy. Again regarding this defibrillator also I'll take one more training. Okay, so in high risk medications we have stored this priority drug and secondary drug. You can see inside like this we have made arrangement. Here you can see atropine, adrenaline, adenosine, cortisol, soda bicarb, calcium gluconate, lox we have, and here you can see lasix, secondary drug, digoxin, naloxone, dobutamine, epsolin, midazolam, noradrenaline, dopamine, and hydrocort. Okay, so these many drugs comes under secondary drug and these many drugs comes under priority drug. Okay, priority drugs in the sense atropine, adrenaline, adenosine, cortisol, soda bicarb, calcium gluconate, and xylocarb. These many are priority drugs. And secondary drugs are lasix, digoxin, naloxone, medas, epsolin, dobutamine, hydrocort, dopamine, and noradrenaline. These are all the medicines we have kept in a first drawer. Next, moving to second drawer. So here we have kept airway contents. So what are all the airways accessories required during intubations? All those things we have kept in a second drawer. These are all the suction catheter. Oral suction catheter we have a size from starting from 6. From 6 to 14. Okay, 6, 8. This is the number 8. 8 and 10. This is the 10 gauge and 12. Next is 14. Okay, for pediatric and as well as for our adults, we have kept each two numbers from 6 to 14. So these are all the suction catheter and these are all ET tubes. Okay, so we have kept starting from 2 number to up to 8.5. Okay, so 8.5, 8, 7.5, 7, 6.5, 6, 5.5, 5, 4.5, 4 and 2. Okay, these many ET contents. Okay, airway contents, ET tubes, and along with that we have kept oral airways. Okay, so this is starting from 1, 2, 3 and 4. There are 4 airways starting from 1 to 4. And we have kept one syringe for inflating of a ET tube. Okay, after intubation, doctor will ask for a inflation of a ET tube. We have to use 10 cc syringe to inflate a ET tube. And here you can see the silicone jelly. Okay, each time you use a fresh one. Okay, otherwise you are going to make infections or contamination if you contaminated jelly if you use during intubation time. This is Meggle's forceps and adult laryngoscope. So this also very important responsibility of the nurse to check for a working condition. Always this should be in a working condition. This laryngoscope consists of 4 blades, 1, 2, 3 and 4, and there are 2 spare batteries should be available in a laryngoscope. And make sure whether it is in a working condition. Okay, you can see it is in working condition. So this is regarding laryngoscope and airway content. So second draw consists of laryngoscope, oral airway starting from 1, 2, 3 and 4, ET tubes from 2 to 8.5. Okay, so all the ET tubes, and to inflate the ET tube 10 cc syringe, Megal's forceps, Locks jelly and suction catheter. So these many we have kept in a second draw. And third draw, here we have kept a circulation content and breathing content. Okay, breathing content, oxygen mask, adult and pediatric, and circulations content like vasofix, syringes, three-way extension, IV set, all those things you can see inside. There are adult and pediatric mask and one rebreathing mask. Here you can see different sizes of IV cannula starting from 18 to 18, 20, 22 and 24. Three-way extension, pressure monitoring line, PM line, IV fix, IV set, adult. This is pediatric IV set. Here you can see bigger gauge like 18 gauge needles to aspirate any fluid during a crash, and syringes, different sizes of syringes starting from 2 ml, 5 ml, 10 ml, 20 ml and 50 ml. Okay, so these are all the syringes we have kept in the drawer. So now you can see all kind of syringes, IV cannula, three-way extension, PM line, IV fixing, IV set both adult and pediatric, needles and oxygen mask adult and pediatric, and rebreathing mask. So in our third drawer these many items we have kept. And side crash cart you can see one step, it should be in a working condition. Okay, and always make sure these defibrillators should be charged all the time. Okay, and here we can kept one scissor also during emergency for any this thing. If you want to break any sample cutter also we have, and even scissor also we can use. Okay. And in our bottom crash card you can see IV fluids. Okay, atropine 100 ml and 100 ml and 25% dextrose, isolate P, Emacil 10% dextrose, DNS, NS 100 ml and NS 500 ml. So these many IV fluid we have kept in a bottom crash card. And here you can see during intubation time for oral clearance we'll use a vacuum, and to collect all the shops we have a kidney tray here and all biohazard covers to collect again biohazard waste. Okay, so these are all the bottom crash cart items. So now you can come to know what are all the items we have kept in a top crash cart, middle crash cart, and all three drawers and bottom crash cart. Okay, so these are all the items, and as per the checklist, this is a crash cart checklist. On daily basis we'll check, and expiry will be checked on monthly basis. Okay, so as per the checklist we have to maintain the crash cart. Once after usage, refill the items and seal the crash cart with the Ziploc cover. Okay, this is regarding crash cart management.